Hello. Thank you for coming in. I'm Dr. Nicola, and I'll be carrying out your health check today. How are you? Good. So I'm going to start by taking your vitals. Alright, my love. Okay. So, let's check your temperature. I'll pop it in your ear, okay? There we go. I just would like to check the other side to be sure. That's perfectly normal. Okay. Now, if I can have your index finger. Thank you. Just pop that there. And just relax for me, okay? Good. So, that's fine. Perfect. Thank you. Let's make sure that's off. Now, can I have your pulse just to have a listen? Okay. Now, the other side, okay? Okay. Perfect. Okay. Now I'm going to check your blood pressure. Okay, if you can rest your arm on here for me. That's it. And I'm going to put this through, like so. Place it there. Is that alright? You will go quite tight, okay? And if you just keep your feet nice and flat on the floor for me and don't speak, okay? Okay, I'm going to do it a second time. Okay, that's perfect. Okay. Okay, that's lovely. Right. Can I get you to just step on the scales for me, my lovely, so I can just check your weight? Thank you. Thank you. You can sit down. And how tall are you? Thank you. Okay, that's fine. Lovely. Okay. Now, if I can just get you just take a nice deep breath in for me, I'm just going to have a listen, okay? Release. Okay. Now, I'm going to have a listen to your chest, alright? Am I okay to just go down a bit? Thank you. Now, if you can just breathe normally, that would be great. Okay. Okay, can you take a nice deep breath in? Hold it there. And release. In. Release. Breath in. Hold it. Release. Okay, I'm just going to go around the back, okay? sounds nice and clear, my love, okay. Just they all sound nice and your heart sounds great too. So that's good. Now I'm just going to have a little look in your eyes, okay? So you just look straight ahead for me, okay? This won't be right. Okay, let your eyes adjust. Okay. Look up. And back at me. Can you look left? And look right. And back. Okay. And just follow my light with your eyes. Good. Look straight ahead. Excellent. Let your eyes adjust. Your eyes look nice and healthy. Okay. When I have some gloves on, I will have a look as well, but they look fine. Pupils are reacting as they should. Why, lovely, okay. Okay, that's lovely. That's really good. Now, if you could just sniff for me. And again. Thank you. Now, if I can get you to swallow. And again. And that feels okay. Lovely. Can you just confirm your age, my love? Okay, lovely. Okay, that's lovely. Okay. I will put my gloves on in a moment, but I just want to ask you a couple of questions, if that's okay. Right, so this being obviously a well-woman check, I just need to ask about your menstrual cycle or menopause status and things like that. Are you still having your periods? Okay. So you're not pregnant. You're still having periods. Right, okay. So perimenopause maybe? Okay. You're probably on the younger side though, my lovely, so not necessarily just yet, but you know, things do happen and things like that. But you are having your periods and a little bit more spaced out than they were. Okay. I could always do a blood test if I need to, my lovely, but are you concerned about your periods at all? Or, you know, are you okay there? Or are you experiencing any pain, discomfort, or any issues? From looking at your records, you don't seem to have any gynecological issues, so I'm guessing everything's okay. Okay, that's good to hear anyway. Okay, we'll just keep an eye on the frequency and maybe do a diary and like schedule when you start having the feelings, when you're coming on and how long it's lasting for, what the flow's like and things like that. If you can do that for me for, I say 3 months, and then come back and we can discuss your periods and then see, let's take some bloods, are we in the perimenopause and things like that, and we can do that if that's all right. Or I could assess you a little bit sooner than that. It's totally up to you. I can do 2 months. Okay, so we'll do assess for 2 months. I will put all this on your records, my lovely. Okay, when I type it all up. Okay, then we can reassess that situation. Okay, but other than that, are you feeling okay down there? Good. Now, were you on any contraception at all? Okay, when was that? Right, okay. That's perfectly fine, and your choice, my lovely, okay. Yeah. And are you married or partner or single, or what's your marital status? Okay, and everything okay at home, my love? You alright? Yeah, any concerns or anything you need to talk to me about? Are you sure? Okay, well if there is, I am here, okay? So just reach out, but home life is okay. Good. Alright, that's good then, so everything's fine. Okay. Now you have children, my lovely. Okay. You're all okay. Okay, good. Now, do you work? Okay, so what do you do for a job, my love? Oh, okay, that sounds interesting. Ah, I like that. Wow, that's amazing. Now, are you alright at work? Are you stressed about anything, or is it alright? Oh, lovely. I'm glad to hear that. That's wonderful. So work's fine as well, which is great. Now, all these areas, I know you say you're doing well, but what would you say your stress levels are like? I know that's quite a hard one. Okay, so if we got a scale of 1 to 10, 10 being the worst, where would you put it? That's quite good. What kind of things, say, would make your stress worse? Yeah. Okay. Yeah, understandable. Okay, so pretty common things really, which is fine. Okay, and what about your sleep? How is that? And I must say you do look quite fresh and, you know, quite awake. Yeah. So how many hours a night? Okay, so that's not bad. And how is your sleep? Is it disturbed? Is it perfect? Or do you struggle to get to sleep? How is it for you? Yeah. And why do you think that is? Okay. So you get quite restless, struggle to sleep, but then when you are asleep you're okay, but you do wake up to go to the toilet quite often. Okay, so do you find you are going to the toilet quite a lot? Has that got worse since you've got older? Yeah. Again, could be sign maybe perimenopause or something like that. We do tend to need to go to the toilet more frequently. But it might be worth checking your bloods a little bit sooner, so we can see what's going on. I think that would be a good idea. So we can check bloods and we can check all the hormone levels and then the other things that I could do with checking. And then obviously that, because just to make sure there's no diabetes going on or anything else like that. Okay, so we'll need to get some bloods done. Okay, so, and how are you after you've slept? Do you find you're sluggish, lethargic, or do you feel quite upbeat? And what are you like getting up in the morning? Yeah. Okay. So would you say you're a morning person or night person? Okay. Yeah. That makes sense. Okay, so overall, our sleep could be better, but it's not really that bad once you're asleep anyway. But it's the waking up, needing the toilet is the inconvenience, and then you're struggling to get back to sleep afterwards. Okay, that makes sense. Yeah, I'd say monitor that. I don't know whether you've got maybe an Apple Watch or something like that you could monitor. I mean, don't go out and spend all your money. I mean, you can always get something cheap. I mean, I've got one that cost me like 30 quid or something like that. It's fantastic. Yeah, so you could try something like that. That way you can monitor your oxygen level, your pulse, and you can monitor your sleep. And I think that will be really good, because then you can come back and we can see what your sleep, what's actually going on, and we can see where the problems are. Yeah, so I'd recommend that you do that. Really useful. Okay, so we're going to be doing a diary about your periods. Okay, and then you're going to be monitoring your sleep, and get one that also does your stress levels and all that as well. And then we can monitor all that, and then when you come and see me, I can see the levels and then see what's going on. Okay, but other than that, you know things are okay. Okay, good. Now, do you drink enough water, do you think, or do you feel like you're lacking? Oh, okay, that's very good. So your water intake's brilliant. Okay. Now, I know this is a hard question usually, but what is your diet like? Oh, okay, that's good. And what about caffeine intake or alcohol? Okay, and do you smoke or vape? Okay, thank you very much. Okay, so it sounds like you're quite healthy, so I quite like that. It's really good. It's a good sign, which suggests to me that maybe your bloods might be normal. So we'll just, obviously doesn't necessarily mean that, but we'll keep an eye on that. Okay, so that's fine. And do you exercise at all? Okay. Okay, well that's fine. I mean, that's good. It's, better than most people. I mean, it's better than me. So yeah, if you're happy just doing that, just stick with what you're doing. Okay, that's really good. Lovely. And if you do have one of those watches as well, you can track your exercise and see what you're doing. Perfect. So that's all that section done. Right, so now just would like to ask, do anyone in your family have a history of heart disease, ovarian cancer, breast cancer? Lovely. So, then I'd just like to ask about your mental health. I know I asked about your stress and everything, but are you okay mentally? Do you feel that, you're okay? Or are you feeling low, sad, depressed, anxious? Okay. And I know like now it's becoming autumn, so, our moods can drop, especially when we get further through the year. Are you doing all right at the moment? Okay, so you're normally okay. All right, that's good. And are you feeling fine and all right? I'm glad to hear that. If that does change, so please contact me. All right, and we can talk about your mental health, but as long as you're okay and everything's fine and we don't need to discuss that further. Are you sure? Okay, lovely. That's fine. Okay. Now, are you concerned about anything at all at the moment with your health? Okay, so you do have migraines, okay. And how often? You've always had those, haven't you, I think? Yeah. And what do you take for them? Okay, and that didn't work. Okay. Have you ever had Sematrapan or something like that? You haven't? Okay, I'm going to give you some of that. Okay. So take it as a preventative if you need to. And like say, you're going to say wake up in the morning with a headache, a migraine, if you've been up late or whatever, then have one then, so it will stop you having a migraine. Or if you've got a migraine, then take one, and if you feel like it's still not enough, you can take another one a couple of hours later. All right, and if you need to, you can take cocodamol with it as well. Okay, I'll get all that sorted and send it to your pharmacy. Just remind me your chosen pharmacy. Okay, I will log in and do that, but I like to write everything down. Okay, so we'll sort that for you, that's fine. And any changes in your medication? Are you happy with what you're on? Okay, so you've stopped that one, haven't you? So we don't need that one. And yes, so you're on, is it fluoxetine? Okay, so that's obviously doing its job. Yeah, so obviously you're feeling all right, you're not feeling anxious, you're not feeling low or depressed and anything, so I'm not going to adjust the milligrams. We'll keep you on that, okay? Yeah. Now, I don't want you to come off them because I'm worried that you're going to come off them and you're going to have a dip, and we don't want the dip, okay? But we'll see how we get on. Hey, you've been on them quite a while, I think. Yeah, I thought so. Okay. Lovely. Okay, so that's all that. Anything else you would like to add, or if you're concerned about any health conditions or issues and you're feeling all right other than the migraines? Okay, lovely. Right, so that is the questions out the way. Okay, so get my gloves. So I've got a couple of things, okay. So what I want to do first is have a look in your ears. Alright, have a look in your throat. Then I want to feel around your scalp and your sinuses and your glands. Okay, then we'll move on to the breast examination and I'll check around your tum as well. Alright. Okay. So let's get my otoscope. Okay, I'm going to pop it in your ears. Okay, and there we go. Does that feel okay? Good. It looks quite nice and clear. Just going to go a bit deeper, okay? just a little bit more wax a bit further down, but it's still pretty normal, okay? I can't see any redness, any swelling, nothing abnormal at all. It looks really healthy. Okay. Yeah, so there's nothing wrong with your ears, so that's not contributing to any migraines, okay? Okay. I'm gonna have a look in your mouth. Open. Say ah. Okay. Now, can you pop out your tongue? Say ah. Good. Okay, and can you just wiggle your tongue? Lovely. Okay, I'm just going to lift up your lip, lovely it too. Okay, your mouth looks really healthy. Can't see any lesions, any ulcers, anything like that. Your gums do look okay, your teeth look okay. Just make sure you are up to date with your eye examination and your teeth, your dentist. Alright, if you can make sure that you do have those every so often. Okay, lovely. Alright, that's fine then. Glad to hear that. Right, now I'm going to put my hand on your throat, and can you swallow? And again. Lovely. Okay, I'm going to feel around your ears now. Any pain? Lovely. Any pain? Okay, that's fine. Now I'm going to feel your scalp, okay? Let me know if you do feel any pain or anything, okay? That feels okay, my love. Okay. Right, so I'm going to check your sinuses, okay? Can I touch your face? Okay. Let me know if you do feel any pain. Okay, that's fine. I'm going to pull down your eye. Your eye, should I have said. That looks fine. Tear ducts and oil ducts look perfectly fine as well, very lovely. And there's definitely no blockages or anything with your sinuses. Now I'm going to bring it down and check your glands. Any pain? Okay. Okay, that's fine. Let me just jot some notes, my love. Okay, so what I will need you to do in a moment is remove your top and your bra for me, okay? Now I will be carrying out the breast examination, just checking for any abnormalities, any lumps and bumps and different things like that, okay, my love? So we just write this down first. Okay. That's fine, that's all that done. Lovely. Right, before I get you to move your top half, I'd just like to ask, have you noticed any changes or any abnormalities? Okay, so not that you've noticed, okay. And do you self-examine? Okay, now we should be examining at least once a month. Alright, and if you are having your periods a few days later, alright, it's important that we are checking, at least having a look for any changes, any abnormalities, and just feeling around just to make sure that we're not seeing any lumps and things like that, okay? It's very important that both women and men are checking just to make sure that everything is okay. Alright, yeah. It's very important that we do that. Obviously we do offer this screening here, but that's yearly. You need to be keeping an eye every month, okay? Maybe like in the shower, have a feel around, have a look in the mirror. I will guide you through what to do a little bit later, my love, okay? Yeah. Okay, but you'll not notice anything strange or anything like that? Any pains or anything? Okay, what about when you have your period? What type of symptoms are you having? Okay, that's fine. Okay, that's good. Wonderful. Right, if you wouldn't mind just removing your top and bra for me, okay? Wonderful. Now, am I all right to assess? Right, first of all, can I get you to just sit as you are? Okay, now if you could just raise your arms, put them above your head. Okay, so when they're up, can you bring them back down? And slowly do it. I just want to see if there's any change when you move. That's it, put them back up slowly. Okay, lovely, relax. Now if you could just pop that arm up for me. Getting down, and this one. Okay, lovely. Right, is it okay with you if I now touch? I'm going to start here and work my way down. Okay. Let me know if you do feel any pain, okay? I'm just going to feel around this one. Make sure we are getting right the way round, okay, underneath. And around the edge, back round into the centre, okay. And then also here as well, working inwards, and also around the nipple area, okay. Okay, now if you can pop your arm up for me. So we can do this while it's in that position, so we're checking again, do the same again, okay. There we go. Okay, then we have to bring it up into the armpit, so we're feeling up the lymph nodes, okay. Sorry if you tickle, but it will be quite fun. There we go. Yeah, that's normal, my lovely, there. That's just normal. Okay. That's fine. You can relax. And the other side, okay? That all feel okay? And pop your arm up for me, thank you. Feels okay. Okay, I'm going to get up into your lymph nodes. Okay. Okay, relax. Can you pop your arms right up, both of them? And just comparing. Okay. That feels okay, my lovely. You can pop on your bra and top. It's fantastic, no concerns there. Lovely. So, breast examination complete and all okay. I can't see any abnormalities or feel anything, it feels fine. So just get to know your breasts, okay? I know that sounds silly, but make sure you know what they look like, what they feel like, and any slight change or thing you notice, and please come and see me. I can do another exam, and if I am worried about anything, I then can refer you on to the specialist. Okay, but as it stands at the moment, they are perfectly fine. Alright, my lovely, you're welcome. Now, do you have any moles or anything anywhere that you are concerned about? No? Okay, good. Now, am I alright if I just have a feel around your tum? Okay, if you can just lift up your top for me. Thank you. Let me know if have any pain or discomfort, okay? Okay, I'm going a bit deeper. Okay. Okay, if you take a nice deep breath in. Okay, and out. You cough. Okay, that's good. So it all feels okay. No pain, no discomfort. Okay, all feels nice and fine to me. Now, how's your bowels? Are they okay? Okay, so you do have IBS, okay. Right, so it's just kind of, yeah, that makes sense. Okay, yeah. But no changes, it's been the same for a while. Okay, that's good. Obviously, we've mentioned your bladder at night, but how is it in the day? Okay. Alright. I don't really want to look at anything like that at this stage, my love, unless you are maybe having some leakage. If you're unsure about that, pop on a little pad and just monitor it to see whether you're actually leaking anything or is it just sweat. Okay. Alright, my love. So, I'm happy with that. You've got no concerns down below at all? Good. Right. Now, anything wrong with your body? Have you been having any aches or pains or anything? Okay, if I can have your hand. Just have a feel. Okay. Is that always the same? Okay, other one. Okay. Same. Okay. On my hands and squeeze. Release. Squeeze. Release. Lovely. That's all fine. And feeling no visual disturbances, no weakness anywhere, or any pins and needles or anything. Wonderful. Well, that's okay then. I'm very happy. I'm very pleased with everything. The findings are great. You seem perfectly healthy and perfectly well. Alright. I do want you to have some blood, so I'll have to get you to come back for the bloods. I will sort that out and get you to be booked back in with one of the phlebotomists. Yeah, and then I can mark off all the bloods that I want doing. But I'll do that on the system, okay? Yeah. There's going to be quite a few things I want to check. Alright, just see if you're lacking anything, if everything's working well. Check for inflammation, any infection, any diabetes, all sorts of things like that, okay? Cholesterol, liver function. Okay, so I sort all that out for you. And obviously, all the hormones, I'll be checking all those for you. Okay. So, let me just recap what I need you to do. So, I need you to keep a diary on your periods and track them. Okay, check your urine if you're leaking or not. I want you to check your breasts monthly. Okay, monitor any changes or anything like that. Okay. Get a cheap watch if you can, like an Apple Watch, but a cheaper version to just track your sleep and everything. And then we can come back and meet in 2 months. Unless there's anything wrong with your bloods, then I'll get you in a bit sooner and we can have a chat. Okay, but other than that, I am happy with everything. So it is Breast Cancer Awareness Month, and breast cancer is very close to my heart, as my mum had breast cancer at the start of COVID, and she was stage 3. Luckily, my mum is in remission, touch wood. She had surgery, radiotherapy and chemotherapy, and she's been on a preventative treatment since to stop it spreading to her bones and things like that. So I would like to advocate for breast cancer awareness, and it's the perfect time with it being the month. I want to just remind everybody that you should be checking once a month whether you're male or female, and you can see a lot of guides online what to do. I've got this just to share with you. Okay, so there's 3 simple steps. Okay, so you want to look at your breasts in the mirror with your shoulders straight and arms on your hips. Okay, you want to use the pads of your fingers to feel for lumps or thickening in a circular motion. And then step 3, check underarms so you feel for any lumps and bumps. Okay, so these are the 3 simple steps that everybody should be taking. Alright, online you will find more detailed instructions and images, so it might be worth just having a look. Okay, so for women, the best time is a few days after your period ends, when breasts are at least tender. For men, choose any day of the month to check regularly. So we're going to be looking for any skin dimpling or puckering, any indents, redness or swelling, changes in nipple position, discharge or inversion. Okay, then you want to feel for any new lumps, any thickened tissue in the breast, swelling, tenderness or pain in one area, lumps or swelling in the underarm. Okay, it's always good to look in the mirror and check for any changes, get to know your breasts. Use the pads of your fingers, do circular motion all over your breasts, including your nipples and underarms. Lie down, stand up in the shower is a good time. Okay, then I just want to say as well that most changes aren't cancerous, but it's always best to get them checked by a GP doctor, and if you are concerned or they are concerned, then they can refer you on for further testing with the breast clinic. Okay, so this is obviously a guide just to raise awareness, and it's not a substitute for medical advice. Okay, and if you do notice any changes, please contact your own doctor. I hope that was all right for you. Okay, you're very welcome. I hope that's of help to you, my love. Alright, so we have a plan now, what we need to do. Okay, and I will book in your bloods. I can do that for you now. Let me have a look. It's tomorrow morning, okay? 10 AM. Okay, lovely. Can get you in. Okay, now I'm just going to tick off your bloods that I want doing, because then they'll get sent over. Sure, I can add that one on for you. Any particular reason? Okay. There we go, that's everything. Wonderful. That's all been sent over. Ready for the morning. Okay. Yeah, I can. What I would do is wait for the blood results first, and then if I'm concerned, I can get you in sooner. If not, I will book you a routine for 2 months. Okay. You're very welcome. Now, I know that's been quite an in-depth exam and a lot of information, backwards and forwards. Is there any questions or anything that I can help with? Any explanations needed, or are we okay with everything? Perfect. Amazing. You're very welcome, my lovely. It was a pleasure to meet you, and I wish you well, and I will see you soon. You take care now. Bye-bye.